Welcome to another episode of the Your Company Health Podcast. My name is Andre Wright. Today we have a fascinating guest. We have Dr. Delaine Fowler of Accelerate PT, and she's here to talk to us about our company and how she's helping companies to help their employees. Take a listen. Very interesting to hear about, your business and how what you're doing in healthcare.
Sure. So I've been a PT for almost 20 years, coming up on my 20th year, which is crazy to think about. I don't feel that much older, but when I started PT, I had this huge bent towards people being well and healthy. And I couldn't quite figure out how to, this sounds funny, but how to apply that to physical therapy, because usually I was getting people who had been hurt or injured or past surgery, and I'm getting them better, right? And I was really blessed to work for a company where they would send us out to different companies to check out like how people work and do things. And when I started going out to the companies, I was like, oh, wow, there's definitely a way to be helpful here. And there's a problem, which is in my clinic, I would see the same injuries over and over and over and over again from the same people, right? The same companies, and they'd be working the same lines. And I was like, what? Why don't they just like fix the problem, right? Which is how the people are doing the work. So this one particular company, I hadn't been out to their facility. So I called them and I said, hey, can I come to your plant? This is what I do. I've been seeing a lot of your employees. I want to see if I can stop these wrist injuries. Well, when you tell a company that, hey, I can stop this injury you keep having to deal with, like, people are pretty happy. So I came out, and sure enough, like I was touring the plant, and this lady probably had a clipboard or something, and she stopped me. She said, what are you doing? Right? Because they all think that person they don't know is probably going to come around and fire them. Mm-hmm. But she asked me what I was doing there, and I was like, hey, I'm a physical therapist, and I see a lot of issues and injuries from this line, and I wanted to see if I could be helpful. She's like, are you serious? She's like, well, let me show you something. She's like, I moved from that line to this line 2 months ago, and my wrist has been killing me. And I'm like, okay, well, show me what you do. So she kept working and doing her job, and I could tell she was reaching over and pushing a button really weird, like with the wrist, like every few seconds she'd reach over and do like some weird movement. And I was like, So I got the maintenance guy, and I was like, hey, can we move that button from here to here? Is there a problem with that? And he said, no, I don't think so. And I was like, cool. And I left, and I came back like a month later or so, and that lady almost tackled me. Oh. Because we moved the button, and she was so happy because her wrist pain went away. And she was like, I thought I was going to have surgery, and I was going to be out of work. And she said, and what's really cool is that all the other people on this line, they don't have wrist pain now either. And then that was the real moment that I was like, oh my gosh, like, we can prevent injuries at work, but companies don't have the knowledge base resource of a physical therapist, an athletic trainer, somebody who looks at movement all day to know how to train people. So we basically, I came up with this thought of the industrial athlete. And so now we go into companies and we change the paradigm for their employees, especially employees who work really hard. They lift boxes, push, pull things, make widgets all day. We go in and tell them, look, you're just as valued and valuable as a professional athlete. Right. And we want to treat you as such. So we put athletic trainers and physical therapists in-house in companies to, we want to be that frontline healthcare provider for employees, because those employees who work hard, they don't run off to the doctor, right? They don't spend their hard-earned dollars on healthcare, not anymore. They got $10,000 deductibles. They they really don't have healthcare anymore. Right. They have a premium they pay for everything.
And I really like that, because what you're doing, you can save companies a lot of money, because you are actually, moving to help proactively, to help these companies to identify these small issues before they turn in something actually bigger and cost the company more money. So it's, I think what you're doing it's really important, and it's really a niche, because I haven't seen this a lot, where we have these PTs actually going into companies to serve clients. So
yeah, and we love it. We know we're making impact, and we get all the positive kudos all the time, right? You solve somebody's problem, you fix their back pain that they thought was just a part of the job. You know,
And
you have a buddy for life. You have
and
an
it's just
advocate.
amazing. And it's just amazing what PT can do. You will have this issue, and you will believe that it's some major issue, and by just going through, PT, it can resolve the issue in no time. So it's just something that we all should invest in more, I think.
Yeah. Yeah. I think everybody should be at the center of their own care, and not just have the primary care physician, which I think is really important, but to have your massage therapist, to have your physical therapist, to have your chiropractor, to have your whoever is in that paradigm for you, have your mental health professional. I think that that's really important for us to start putting ourselves in the center of care instead of putting like our dollars in the center of care, which healthcare has done as well. So it's a great big joy for us. We feel like we serve everyone in that situation. Everybody wins. The employee wins big time because they get a frontline healthcare provider. Can we prescribe medications or anything like that? No. Can we diagnose, I don't know, appendicitis? No. But anything musculoskeletal, we can really, really help. And then the managers have less paperwork, which they're super pumped about. And then and less people dealing with complaining, right? Like I always like, we take all complaints. And so the manager has that outlet of or HR person, instead of being like, well, I'm sorry you're hurting, they can be like, oh, go see Delaine. Go talk to, that sounds like a athletic trainer issue. Go. And then of course, you're right. The companies save millions of dollars.
Of course. And my question to you is there a specific niche that you focus on, or is just any company?
We are big. If we really wanted to niche down, we would do grocery store warehousing is one of our big usually those things are really standard and procedures are standardized, so we can go in and standardize how we do things. But we have manufacturers. We like employee bases that are 100 employees or more, just because we think we can save the company as much money as we cost with 100 or more employees kind of in one place. We're about to start with municipalities. So we have a municipality where we'll go to them, but they'll also come to us too. So that'll be a neat thing. So we're a little bit diverse, but if you could say, if I could pick one area, like grocery store warehousing is really a fun place to be. Yeah. So it weathers economic storms and all of that too for us. Like manufacturers, depends on the demand of the product and who's selling what.
Because you serve all industries, because you serve people. So wherever people work, that's right. You can help. So my question for you, because I know you're in North Carolina, but do you go outside? How far do you travel?
Yeah, so we have 22 states in the U.S. So we're US based and 22 different states at the moment. Yeah.
Okay. And you don't do overseas, or it's all local?
Yeah. Yep. We just started a virtual first aid. So that could allow us to help some international companies. We have companies that are internationally housed. So we could definitely see doing some care with them. A lot of times we find that these companies where they're housed already have like universal healthcare. So people are at some degree getting what they need in those other countries, depending on how their healthcare systems work. But yeah. So
talk to me, tell me a little bit about the process though. Like if, I want you to come into my company, what's it's like? What's your process?
Sure. So if you say, hey, we'd like to chat, we definitely chat, find out what you're really looking for, what the goal is, right? PTs are all goal driven. Like I have to know the goal, right? The reason I'm talking to Andre is Andre has a podcast. Like Andre is helping me build my bullhorn to get the word out about what we do, because it's valuable. And then how am I going to serve Andre in that too, right? How am I going to help Andre? Because Andre's going to help me build a bullhorn. So with our goal, we decide what is their goal? Like what would they really like to see happen? Once they're like, yeah, let's do this, we do an on-site evaluation and needs assessment to say, okay, here are the things we're going to implement first. Here's the things we're going to implement second, third, fourth, fifth, sixth. And then we come in and put our system in place, but we customize it to each company we're with, because every company is just like every person. They all have their own pulse, their own rhythm, their, the way they do things, their culture. And we just want to impact that culture positively as we come in. So, and then we hire an athletic trainer, PT, or multiple to put in-house with them to start taking care of their employees.
Right, right. Yeah, that's great. As what you mentioned, always want to assess the objective, and then you build from that. So is there like an initial like intake fee, or what's the pricing like, or how does that work?
Yeah. It depends on the company. So if I have a company that say they have 40 warehouses in the US, right? Like that's going to be different than if it's one company with just 100 employees or so. So the pricing kind of depends on the need and what they want. Do they want a part-time person? Do they not want anybody at all? Do they just want virtual stuff? Do they want, so the pricing depends.
Right, right.
Yeah.
And Delaine, I've spoken with different chiropractors. So for me, PT is it's like chiropractors where people tend to be more reactive. They think PT or chiropractic is something that maybe we can do whenever we want to do. But why do you think that perception is there? Like you don't need to be proactive.
Yeah. I think that a lot of us, we're all really good at knowing where our threshold of tolerance is, and including me. Like I'll put up with so much pain, but when it crests over that pain, not dealing with it. Like I'm a runner, right? Like I'm a triathlete and a runner. I do not mind hurting, right? I will hurt I will. But if I get to hurt so much that I can't do running or can't do triathloning or can't pick up my kids or whatever, that's a problem. So I think a lot of times we don't think about, preventative stuff sometimes takes a little bit of discipline and effort. And maybe it's just not in the cards for us. But there's a lot of times with people with back pain, I said, let's look at your desk. Like we can start simple. Let's look at your desk and things that you don't have to think about to start helping yourself. And then so you have to get slow buy-in. But when people are like, oh, I know if I do this, I get better. That's when the buy-in happens. So for instance, at my PT clinic, so I own a couple of physical therapy practices, and we teach a certain method. I call it search and destroy. Mm-hmm. And so search and destroy is basically somebody comes in and they're like, oh, my shoulder hurts to move. And you're like, okay, well, what is that pain? 0 to 10. And they're like, oh, it's like an 8. And I can't, and you're watching them like this one moves fine. And this one's like on the struggle bus. You're like, okay. And then I start poking around on different muscles, different joints, different tendons. And once I find the one that turns off that pain and I push on something and they do that movement again, they're like, oh my, like you'll watch their eyes, like their eyes will be like, that doesn't hurt. I can do it. Right. And when we find that trigger that turns off their pain, then I know as the PT how I'm going to help them, and they know I can help them. So when we do that search and destroy, test, retest method of turning off pain, that builds a lot of buy-in as physical therapists. I think chiropractors have the same thing. They'll come in and say they'll do the flying 7 and they'll crack all your things. Or they'll do something really specific, and you hurt when you walked in, you don't hurt when you walk out. I mean, that's fine. You'll go back to see that person.
Exactly.
The thing is, does it hold, right? So I have chiropractor friends. We can, in North Carolina where I live, we can, as PTs, manipulate as well. And I always say like that chiropractic is great, but what's the training after that what's the training on the muscles
to maintain,
to keep those joints where that chiropractor magically put them, amazingly put them back in place. So I try to work a lot with our chiropractors to do that. Like, let's get this person, back square, get them out of a bit of pain. But once they're out of a bit of pain, they need to be training. But yeah, I think it takes a person. And sometimes people I don't know if you're like this, but sometimes people want to hurt. Like it gives them something to be interesting about.
Right. So, no, that's true.
Every once in a while you have that,
Yeah, as what you.
I have an aunt, but something's always wrong with her,
And as you clearly put it, I mean, I think that's how we're made up. If we're not extremely hurt, we'll like push it off, and we don't have to do that as yet,
I'm good with it.
and so it's just and as you said, if we go in for a session and we realize that you solve an issue immediately, then we can definitely get the buy-in and continue with the process. So I think that's a big part of it. I try to do the right things so I'm not hurt, but I know the value in terms of a physical therapist, and I think it's very necessary, most of the times. But in terms of your collaboration and networking, who do you work with the most? Is it medical doctors, or do you have any like a referral network with them, or how does that work for you from that perspective?
So as far as our PT clinics go, I've been in the same area for 20 years, so have been lucky to get to know our community. And we're an independent practice. We aren't owned by a hospital system or anything, so that makes it challenging because hospital systems want to keep their referrals in-house and all that, and that's fine. Luckily, because my team has done such a good job over the years of treating people well, being purposeful about getting people better, that anytime a patient walks into any of those doctor's offices and they say, I want to go to Accelerate, the doctors are happy to write that, so they don't try to talk them out of it or anything. They're like, this is a patient choice. They're going to go to Accelerate. And so I really appreciate our doctors for staying that course to say, hey, this is a patient's choice that they want to go to Accelerate, but also, and to appreciate us, because we appreciate those doctors as well. And we always are so glad for our patients, our past patients, to say, like, those are my physical therapists there. Just like you have your doctor, your massage therapist, your chiropractor, you need your PT.
And those are
they have your
and you're right, and those are the best referrals when they actually come in from your customers or your patients. So that's always
we have a pretty big list, right? We have a pretty big list of patients, and we chat with them quite a bit too. Yeah. Sometimes it doesn't pay to be in network with an insurance, so we take cash as well. So we do cash pay, and we have insurance bases. We do work comp, and then, but like for instance, and hopefully United Healthcare is not a sponsor of yours, but hopefully anyway. The reason why we're not in network with United Healthcare is because, like, a patient would have a rotator cuff repair, and we would write an appropriate plan of care for them. We need to see them 3 times a week for 6 weeks, 2 times a week for 6 more weeks, bada bing, right? And United Healthcare would say, you can get 3, we'll approve 3 of those visits, and then you're going to write us a note. This isn't the doctor asking for a note. This is the insurance company. We do 3 visits, we write a note. 2 weeks later, they approve 3 more. Now, that means that any PT I might do between those 2 weeks, insurance companies don't pay for. So who pays for it? The patient.
Patient, yes.
Well, when I tell them that these visits aren't going to be covered, what does the patient do? What do you mean? Yeah.
There'll be a problem.
They're not going to deal with that. So we were in network with United Healthcare for 1 year because I wanted to find out, like, what the scuttlebutt was, why all my friends don't like it, all my PT practice owner friends. And I found out why. And we dropped it, not because the payments were bad or blah, blah, blah. It was because there was constant paperwork over and over and over again. They're not the only insurance company that does that. Constant hurdles for my team. I mean, I pay people over 6 figures a year just to deal with insurance companies in my little tiny practice. Just to deal with insurance companies. So, I mean, I can get on a soapbox about what's wrong with healthcare, and that's one thing. But we dropped it because it wasn't serving our patient. It wasn't serving our patient.
And of course, and you don't want these barriers, because as a patient you want everything. You're paying your for your insurance every month. When you're ready to use it, you want it to be as seamless as possible. And that's where the frustration comes in.
No doubt. Yeah, no doubt. It's frustrating on our end too. Your providers don't like it either.
There you go.
So
there you
it's
go.
broken. It's broken. It's continuing to break. So it'll be interesting to watch healthcare over the next decade. Well, I don't think there's one solution, but I feel like our injury prevention programs that we put in-house with companies is a solution. Companies are rather have the expense of the healthcare provider in-house and pay for that versus and know what the cost is going to be than the unknown
right.
of cost. Yeah. So for instance, our municipality, we're not just going to see employees that are hurt at work. We're going to see anybody that's on their benefits plan can come to see us, and the municipality's paying us to be there.
Right. And again, then that's less for companies. That's less red tape, because going through the insurance, as you mentioned before, there's so many paperwork and things to do, and it's just a lot. So I think I like that. I think that's a solution that you mentioned, a good one too. That's why companies should be aligned with someone like you to help employees to get things in order. I know we're close to our time. We could go on and on. I want to ask you this though: what's your digital marketing strategy? How do you utilize digital marketing for your practice?
Sure. So in a couple of different ways, we definitely are active on LinkedIn. I like to celebrate my team on LinkedIn, let our similar businesses know what we're doing, and just be there online in a LinkedIn presence. We market on Facebook and Instagram to our local communities for, to just get some lead generation there. And that's part of our digital marketing. We'll do paid ads, we'll do organic reach with that. So we do a little bit of that. And, but I've found that it's really not until people know you that they're ready to take that big leap. So we push for reviews. We want our patients to all say, like, how they're doing on Google. We love that. Plus we love the kudos. And then internally we do a lot of email marketing, not just to our patient list, but to our client company list, to say, hey, here are your employees giving feedback about our athletic trainers. So we go and ask employees to give feedback, and then our employers really like that because they're hearing from their employee base about the benefits of what we do. So we're multifaceted. I don't know if we do it like just, if we could do it on point, I would love that. Like if I felt like every single dollar was super well managed, I'd love that. But sometimes I'm like, ugh.
Well, but I think you're doing the right things. It seems like you have a multifaceted approach, which is always good. The idea is to ensure that you're tracking and seeing, what's working and what's not. So what would you say would the best, the best form for you, the most profitable channel?
PT clinic for sure. It's our list. We love our patients. We keep loving on them. We want them to come back to us. We want them to know that we want them to be ours forever. So our email list is by far our most important thing. It's the way we connect with our community. And with our industrial injury prevention, we've been less aggressive with that, more and more every year of how we reach out. But certainly LinkedIn and getting into Messenger and start chatting with people. We have their LinkedIn Recruiter Lite, and we can use Recruiter Lite. We do it on the recruiting side as well to find great talent, but we can also find good people to chat with on there too.
All right. Perfect. And for our listeners or views, how can we reach you?
Sure. So you are welcome to reach out to me on LinkedIn, Delaine Fowler, and I'm sure Andre will put my name in the chat below. And then also you can go to accelerate-pt.com or Working Healthy U. So that's Working Healthy with a U.com, and you can reach out to me there.
Alrighty, perfect. I think it was a great chat, and we learned a lot about you and the company, and I think it's just fascinating, and looking forward to connect with you more.
Let's do it. Okay.
Of course.